My name is Mark Emberton. I'm a urologist working at UCLH. It's towards the end of November now. The autumnal months are upon us, and that allows us to reflect on issues related to prostate cancer because of the worldwide Movember movement, which raises money and funds research and supports patients with prostate cancer. We've been involved at UCLH now for a long time in transforming or trying to transform the pathway for men who are suspected of having prostate cancer. At UCLH, we were probably the first in the world to start using MRI for prostate. And I do remember those first images in 1999 when we used MRI to assess the response in the prostate to a laser treatment, which was an experimental treatment we were doing then. So how does MRI help men today? Well, it helps them considerably. It gives men an opportunity to avoid an unnecessary biopsy if the MRI is negative. We wouldn't dream of biopsying a woman's breast if the mammogram was negative, and now it'll be the same for the prostate. This means that 250,000 men, maybe up to 500,000 men a year, may be able to avoid an unnecessary biopsy, avoid the harm, and the healthcare systems will be able to avoid the cost. In those men that do need a biopsy, how does MRI help? Well, it gives us a target. It tells us where in the prostate the area of abnormality is, and rather than trying to find it by a blind interrogation, we can direct the needles at the cancer and moreover sample the cancer in several places, and this represents the heterogeneity, in other words the extent of the different types of cancer that exist within a man's single cancer. Going forward, MRI is going to give us insights into the underlying mechanisms that inform or indeed predict cancer progression. So there's a lot of good news to speak about in November 2017. The Movember movement has allowed us to accelerate much of the research that we've done, and we've done that with patient groups. The Movember team are involved in funding a lot of our work. And so hopefully this time next year, if I'm invited to give a further update, we will have some new insights into one of the most common cancers in men.